Today I want to provide you with some information regarding the coronavirus and how to get tested for the coronavirus. The information I'll be providing is from the LA County Department of Public Health and the CDC. According to the LA County Department of Public Health and CDC, there are certain criteria that a person must meet in order to qualify for getting tested for the coronavirus. There are three criteria, however, you only need to qualify for one of them. The criteria include clinical features and epidemiologic risks. The first criteria includes fever, signs and symptoms of lower respiratory illnesses such as cough and shortness of breath, and any person, including healthcare workers, who have been exposed to a laboratory or a confirmed coronavirus patient within the last 14 days. The second criteria includes fever, signs and symptoms of community-acquired lower respiratory illness, and cough, shortness of breath, etc. And a history of travel from the affected geographic areas according to the CDC, which I'll go over shortly. The third testing criteria includes fever with severe acute community-acquired lower respiratory illness, such as pneumonia, ARDS, etc., and where the patient has required hospitalization in the ICU. Now, the affected areas according to the CDC are the level 2 geographic regions. These regions include China, Iran, Italy, Japan, and South Korea as of February 28th, 2020. However, as people know, the surrounding countries of those affected countries have multiple cases of the coronavirus. For example, France and Germany both have over 1,000 cases confirmed of the coronavirus. Problem with testing criteria 2 is, even if you're showing signs and symptoms of the coronavirus, you will not be given access to the test unless you're from the designated affected geographic areas, which is very limited. So a person may have the coronavirus but be denied access to the test because they're not specifically from the 5 countries previously listed. The problem with testing criteria 3 is that even if a person is hospitalized in the ICU and given a respiratory panel, they must wait for the results of that respiratory panel. Now, while they're waiting for the results, they could have infected a large number of people. If a patient is able to jump through all of these hoops and finally get tested for the coronavirus, there are only currently 1,200 testing kits for California. LA County alone has 10 million citizens, where California has 40 million in its population. 1,200 test kits for 10 million citizens. You do the math.